Good afternoon. So, good evening all, and thank you very much for coming to the last of two Q&A live stream sessions we will be holding. My name is Yasmin Abbas, and I'll be hosting this short live stream session today. I would like to begin today's session once again by explaining the aims of this Q&A series for anyone who was not able to attend or has not yet watched our previous live stream. This event is organized by APEC Ghana in collaboration with Ghanaian healthcare professionals, Madame Emma Akwamoa, who we spoke to last Thursday, and Dr. Charles Buckman. APEC is the sole preeclampsia working advocacy agency in Ghana with the aim of saving the precious lives of mothers and babies through education and support. In alignment with the mission of APEC Ghana, which is to provide education on preeclampsia and raise public awareness, this Q&A series began with a 3-week-long campaign to collect questions through the APEC Ghana web social platforms and about hypertensive disorders of pregnancy. This project continues from last Thursday's session, covering some of the same content, but with a different perspective. The difference in perspectives of both professionals' practices adding depth to the conversation. As mentioned last Thursday, this project will culminate with the sharing of these answers through the recorded live stream sessions and take-home messages, which will be found on the APEC Ghana social media platforms after the closing of the Q&A series today. Now, I would like to introduce our healthcare professional of today. Here with us to answer the questions you have sent in is Dr. Charles Buckman. Dr. Buckman is a consultant obstetrician, gynecologist, as well as the founder and director of the Buckman Hospital, Buck Hospital Specialist and Fertility Center. Dr. Buckman, good evening, and thank you very kindly for joining us to this event tonight and helping us learn more about hypertensive disorders of pregnancy. So I will begin with the questions previously asked by on our social media network, many of the same questions as those that were asked to Madame Aqua, and then allow Dr. Buckman space to respond to these questions. If time permits, we will take live questions from the audience of this live stream. The first question reads as following: why is it difficult for a woman with eclampsia to have a stable blood pressure after delivery? Please, Dr. Buckman. Sorry, doctor, we're unable to hear you.
Can you hear me now?
Yes, loud and clear. Thank you.
Okay, right. Sorry about it. Yeah, so as I was saying, eclampsia is when the woman fits whilst pregnant or after delivery. So, like the most severe form of preeclampsia. If the BP is controlled within 6 weeks, as in during the puerperium, then it's either preeclampsia, is as a result of preeclampsia. But if the BP stays high even after 6 weeks, then it moves on to chronic hypertension, as in the person. It's not because of the pregnancy that the person had a BP. It's more to do with the person's like, let's say the person had high blood pressure before the pregnancy, and which has continued even after the pregnancy. So I don't know if I'm making sense. If it is due to preeclampsia, the BP should be controlled by 6 weeks. So whether it's eclampsia, even if it had the extreme form of preeclampsia, being eclampsia, within 6 weeks, BP should be controlled. If it continues to stay high, even with the maximum doses of medications after 6 weeks, then it moves on to chronic hypertension. Then it could be either primary or secondary. If it's secondary, then we have to find out other causes of the hypertension. It could be from the kidney, the adrenals, any other thing. But once it's from preeclampsia, it should be resolved within 6 weeks.
Thank you very much for your answer. I will move on now to the next question, which reads: Is there any evidence of a connection between SLE and preeclampsia? I have markers in my blood, ANA positive, I think, but I have no symptoms of lupus. I had an autoimmune screen done after developing severe preeclampsia. I also have hypothyroidism diagnosed almost 20 years ago, but I've been told that this doesn't cause preeclampsia. So once again, just to repeat, the question is there any evidence of a connection between SLE and preeclampsia? Thank you. Please, doctor.
Yes, there is a connection. Actually, now with advances in rheumatology and management of hypertensive disease in pregnancy, now people with SLE who are pregnant don't have as much fear as before. Previously, if women with SLE would have to approach pregnancy with a lot of trepidation because it was dangerous. 25% of women with SLE will develop severe form of preeclampsia. The reason is actually it's one of the risk factors for developing preeclampsia. As we all know, preeclampsia, we don't really know the exact cause, but it's more to do with generalized vasoconstriction and placental dysfunction. So SLE is one of the risk factors for developing that. But with advance in management of rheumatology diseases, even if the person with SLE has hypertensive disease in pregnancy, it can be managed. Yeah. So to answer your question, 25% of women with SLE will develop a severe form of hypertensive disease in pregnancy, but it can be managed. Hypothyroidism also has a risk of developing hypertensive disease in pregnancy. In my reading, I didn't come across a particular figure, but it's one of the risk factors. There's really no particular association. It's more to do with other conditions that the hypothyroidic woman may have that may predispose her to having the hypertensive disease in pregnancy. You know, hypothyroidism patients usually are obese, and also they may have diabetes, and all these are risk factors for development of hypertensive disease in pregnancy. So as I'm saying, it's more of an association. There's really have been no direct link to hypertensive disease in pregnancy. It's more like an association. I don't know if I've made sense.
That made absolute sense. Thank you so much, doctor. And I will read now the next question. As a preeclampsia and HELP survivor, how should I prepare for a second pregnancy? What is the risk of having these conditions again?
Okay, so as HELP survivor means the person had a very severe form of preeclampsia. Usually for reoccurrence, it depends on the severity, it depends on the time of onset of the previous preeclampsia. Previous history of preeclampsia is one of the risk factors for developing another preeclampsia, and about 15% of women who had a previous preeclampsia may develop another preeclampsia in another pregnancy. The only issue with it is they can be helped. I'll come to that. So to answer the question, about 15% of people with preeclampsia will develop another preeclampsia in another pregnancy. However, the person will have to determine her risk factors that made her develop. If any risk factor has been found, let's say if there was obesity has been a risk factor, then she has to work on herself. Usually, it's advised that within 1 year, she tries to get back to her pre-pregnancy weight before she attempts another pregnancy. That will help reduce her risk of developing another preeclampsia. If there's any other risk, let's say diabetes, then she has to work on getting her sugars under control. This will also help reduce the risk. But aside all this, soluble aspirin can also be started even prior to her getting pregnant. The recommended dose now is about 150 milligram a day. But in any case, even if it's not started before pregnancy, within the first 3 months, certainly not later than 16 weeks of pregnancy, she should start soluble aspirin as well as calcium. All these help reduce the risk of developing a recurrence of preeclampsia. Yeah, so I think that's it. So the main thing is trying to find out your risk factors and working on them before the second pregnancy.
Thank you so much. What are the long-term effects of preeclampsia? Please, doctor.
Okay, so there are long-term effects for both mother and the baby. Because, as we all know, preeclampsia, the underlying cause is generalized vasoconstriction and the placenta dysfunction. It sort of carries on even if the BP becomes controlled after 6 weeks. Later on in life, she's at risk of developing chronic hypertension. She's at risk of developing diabetes. She's at risk of developing other cardiovascular conditions and even kidney disease, all because of the chronic vasoconstriction that she's been exposed to, which sometimes carries on into later life. For the baby, most of women with preeclampsia, their babies end up having iugr, intrauterine growth restriction. So that alone is a risk factor for the development of cardiovascular conditions later in life and even obesity. Interestingly, those with intrauterine growth restriction, a baby with intrauterine growth restriction ends up being obese later in life. And that is a risk factor for development of cardiovascular conditions later in life.
Thank you. I will read out the next question.
Okay.
This is a bit of a longer one.
Okay.
I had preeclampsia in my first pregnancy in 2018. As a result, my BP was well managed with medication in my second pregnancy from 2020 through to May this year. And I had no problems except for the early onset of gestational diabetes. However, a week after delivery, I noticed my BP started to rise even though I was on the same medication in the same doses like when I was pregnant. I was readmitted and managed for postpartum hypertension, and another medication was added on. I can't seem to understand how this would happen. Could the preeclampsia in the first pregnancy have resulted in this as well as gestational diabetes? Thank you.
Thank you. So this is as in she developed postpartum hypertensive disease. It's not that common, but it happens. It's also to do with the risk factors I've already talked about. So for her risk factors were she had gestational diabetes, as well as her blood pressure was high, even though it was controlled during the pregnancy. So those two are risk factor for developing hypertensive disease in preeclampsia in that index pregnancy. And if it didn't happen during the pregnancy, after delivery, there's still a risk of it happening all the way up to 6 weeks. There are other risk factors, like generally for the hypertensive disease in pregnancy, obesity, antiphospholipid syndrome, all those. So she certainly has the risk factors for development of postpartum hypertension. Yes, and the preeclampsia in the first pregnancy is one of the risk factors for her developing another preeclampsia, even though it happened postpartum. So that's it. That's correct. Her assertion is correct.
Thank you very much. The next question reads, good morning. My name is Sheena from Nigeria. My wife gave birth on Wednesday, but it was a stillbirth due to preeclampsia at 34 weeks. He said it was due to the high blood pressure. He assured us that it won't recur in the subsequent pregnancy because she is immune to fight it. I would like to confirm if this statement is true and also when it is safe for my wife to get pregnant again. Thanks in anticipation.
Okay, thank you. I don't seem to understand how you'll be able to develop immunity to hypertensive disease in pregnancy. As we all know, that is not a correct statement. Because as we already said, once you develop preeclampsia in a previous pregnancy, you have about a 15% chance of developing it again. You can't develop immunity against it. your chance rather could be lowered if you work on your risk factors, as I've already talked about. If you can lose weight, control your diabetes, if you have hello.
Thank you,
Hello.
Doctor. Hello. Can you hear us?
Yeah, sorry about it. Yeah.
No.
So certainly it is not a correct statement that it won't recur because you are immune. You are not immune. And the other question was, when is it safe for his wife to start to get pregnant? Okay. So as I've already talked about, she will need to work on herself whilst trying to get another pregnancy. But it's actually pregnancy interval that is recommended for any couple is 18 months, irrespective of whether it's she had a previous preeclampsia or not. It is good because then the wife's body is able to get back to normal before embarking on another pregnancy, and also usually if you are to have a very short delivery interval, as in she gets pregnant, let's say within 6 months of having a child, she has a high risk of having a premature baby in that pregnancy. Like the risk of prematurity or preterm delivery is high. And so aside the risk of the preeclampsia being higher, because she may not have been able to work on her risk factors before embarking on this pregnancy, the baby is at risk of being premature as well. So preferred interdelivery interval is actually 18 months. So if she can give herself close to about 2 years before embarking on another pregnancy, it will be ideal.
Thank you. The next question reads, a question about preeclampsia. My baby was stillborn due to preeclampsia and I was extremely poorly. Since then, I have found it hard to get pregnant again. We have now been trying for 18 months. Could this be due to the effects of preeclampsia on my body? Doctor, I know you've touched upon this already, but maybe if you'd like to add something.
Yeah, so the preeclampsia will not lead to infertility. They are two separate things. So I don't think it's the preeclampsia that is causing her not being able to get pregnant. They probably have to be assessed to find out maybe it's possible that the partner's sperm has, anything can happen. It could be due to the man, it could be due to the woman. Interestingly, 40% of infertility from a man, and it can happen at any time. It could be due to chemicals he's exposed to or anything. So a lot of, in our societies, they put more blame on the woman than the man. So both of them should be investigated to find out why she's not getting pregnant. It could be due to anything else, but not due to the preeclampsia.
Thank you very much.
Okay.
When is the best time to get pregnant again after severe preeclampsia experience with my first pregnancy and losing my baby? Again, once again, you have touched upon the topic, but maybe if you want to add something, please.
Yeah, so as I've said, it's best to wait at least 18 months before embarking on another pregnancy. And whilst waiting, work on your risk factors. Try and get to your pre-pregnancy weight before you embark on another pregnancy, and then work on your risk factors, basically.
Thank you. The next question reads, does preeclampsia cause symmetrical iugr? My baby had symmetrical iugr, and they thought about torch infection and chromosomal anomalies. But lastly, I developed severe preeclampsia. So again, the question is between preeclampsia, the relationship between preeclampsia and symmetrical iugr.
IUGR, yeah. So symmetrical IUGR is when the baby is proportionally small. So it's small for gestational age. You can have a constitutionally small baby because probably it's genetic. Maybe the mother is small or the father is small. That is normal. But you can still have symmetrical iugr from a condition. Usually, if it is due to chronic hypertension, as we all know, chronic hypertension happens early. So throughout the pregnancy, from the first trimester all the way to delivery, you are going to have the hypertension affecting the vessels, affecting the placenta, and so placental function reduced, and so then baby could be proportionally small. But for preeclampsia, as we know, preeclampsia happens in the second half of pregnancy after 20 weeks. So with preeclampsia, babies that are small are usually asymmetrical. It is usually, as we said, placental function reduces, and this happens after the second half of pregnancy. And so the energy that was supposed to be evenly distributed will rather be channeled towards the vital organs, the brain, the heart, kidneys, adrenals. And the others will be sacrificed. The liver, the muscle, other places that are not so vital will be sacrificed. So with asymmetrical iugr, we're going to have the head circumference of the baby being normal, but the abdominal circumference will be small because the liver will be small. So if you have a symmetrical iugr, it's likely that it is not due to preeclampsia. That is why they probably went on to investigate for torches like those viral infections, toxoplasma, rubella, CMV, hepatitis, and the like. And then to find out if there was any chromosomal abnormality, that could also lead to symmetrical iugr. But as I've said, it could be due to chronic hypertension. That could lead to symmetrical iugr. But if it is preeclampsia, it is not likely to be symmetrical. It will be asymmetrical.
Thank you very much. Thank you so much, Doctor, for sharing some answers and adding so much depth to the conversation that we started last Thursday. Okay. I don't see any questions currently on the live chat, so I will wait just a little longer, but I was wondering if you had any closing words or take-home messages for anyone who may be watching or a specific audience.
Okay. Yeah. So what take home is once you've had a previous preeclampsia, you have, it's not too high, but 15% is quite high, that you could still develop another preeclampsia. And so whilst waiting, take home messages, let's wait for at least 18 months to get another pregnancy. And whilst waiting, if you try and work on your weight to get to a pre-pregnancy weight, to your pre-pregnancy weight. If you are diabetic, get treated to make sure your sugars are well controlled, because all these are risk factors for developing preeclampsia again. And you can start soluble aspirin. Recommended dose is about 150 milligram now, and calcium, between 1 gram and 2.5 grams a day should be ideal. All these would help reduce your risk of developing preeclampsia. It doesn't mean that it won't happen. It could still happen, but at least it will reduce your risk. The good thing with these is if you have a previous preeclampsia, if it recurs, it's usually milder. So that is at least some consolation. It will not be as severe as the previous, but if you had an early onset preeclampsia, as it happened before 28 weeks, and it reoccurs, it could be, even though it will be milder and could happen a bit later than the 28 weeks, you will still have a severe form of preeclampsia because it happened so early. So all I'll say is, even though your risk of having it is about 15 to 20%, you can still be helped, and work with your doctor so that the next pregnancy is treated as very delicate, and then you attend hospital more frequently, and then your baby will be assessed more frequently so that you end up with a good outcome compared to your previous outcome.
Doctor, there are no more questions in the live chat. This has been an incredibly educational session, and thank you for your incredible knowledge and the knowledge you've brought today. Thank you for your presence. It's like I said, it has really enriched the conversation that we aim to create around hypertensive disorders of pregnancy. And I've now left on the screen some of the APEC social platforms where we will be sharing the take-home messages from the knowledge shared by Dr. Buckman today. Thank you very much, Dr. Buckman.
Thank you. Thank you very much too.